Patients. It's who we're here to serve. We're here for the whole community of Gateshead, and all of us will be a patient at one day, and we need to work on how we can get the best feedback from everyone so that they can tell us about the services that work really well and the services that need improvement. And our role in the CCG is to try and work out lots of different ways that patients can help us with improving services. So we want to be a patient-focused organisation that has lots of opportunities for patients to help us get the best services we can. And we're wanting to work with people on engaging them, and we've described this at 4 different levels. Firstly, in how we run the Gateshead Clinical Commissioning Group and how we involve people in the big decisions we have to make. Secondly, in how we improve our services and get people's feedback in how they would like services to look. Thirdly, in the information that people give practices who often get an overview of the whole of the services in Gateshead. And then lastly, how we go out into the community and work to listen to the views and the ideas that people have for how the whole system could be better. I want to tell you a little bit more detail about each of those areas, and I want to start off by telling you about the running of Gateshead Clinical Commissioning Group. Firstly, we want to make sure that those decision-making times have got someone that's a real champion for patients, and this lay member or patient champion will be on our governing body there when all big decisions are made. We have lots of formal systems where we try to collate the information that patients tell hospitals and other providers, such as GP practices, about what they think and how things could be better. And we get all of those trends and information back to a monthly meeting where we review the quality, and we also have lots of other reports there about particular incidents or harm that's happened in different hospitals, and we can review what plans are in place to get things better for people. Of course, it's important that we don't just have those formal systems, but we also have a chance to listen to people directly, and we have a lot of patient involvement groups to try and do that. I want to now tell you about the services and how we've listened to patients and got people's help with trying to get the services the best they could be. So we've involved patients in the design of new and improvements to existing services. Let's talk about some examples. Firstly, diabetes. People wanted the services in hospital and in practices to be more joined up, and we've been able to do some work on doing that. With dermatology, people had to travel outside of Gateshead, and they wanted to have services that were quicker and seen nearer to home, and we've done that. With heart disease, people wanted to have their problems managed more in the community if possible, and we've done a lot of work with trying to get the follow-up for patients with heart failure back into practices. With musculoskeletal problems, there was a large waiting time for things like physiotherapy and then seeing experts in hospital, and by redesigning the service, we've been able to get people seen much quicker by the person that they need to see. Let me give you now some examples of how we've worked with practices to listen to the views that patients tell practices, not just about the care that practices provide, but the care that others provide across the whole system that often they tell their GP or their practice. So we've got patients in practice involvement groups, some virtually on the internet and some all meeting together to try and give that feedback. And we've been working with practices and the managers of them to collate themes so that we can try and act on big problems. So now let me tell you about our work in the community. We want to listen to people, and we want to do that with lots of other organisations to avoid asking the same questions to people. And then we want to respond to that feedback and work together with all of the different partners in Gateshead so that we can have a better approach to listening to what patients are telling each of us and trying to work with them to plan to how things could be better. And we'll have a really important relationship with HealthWatch, who will be an organisation specifically set up to champion the rights of patients. So let me tell you how this works in practice. Firstly, we have our local engagement board. This is a public meeting that has excellent attendance and is a forum for the public to ask questions and for the CCG to get feedback on how we can improve services. There's a chance for updates, but also table discussion about how we could get things better. There are many other groups we work with, and we have our patient, user, carer, public and involvement group, the PUPI group, and this reports directly into our governing body and has representation from 80 patient groups and individuals. And there's many other work that we do with specific groups in the community, such as our Jewish community. There are lots of other ways we've worked with the community to try and get people's involvement and people's ideas. We've worked through particular providers who already had relationships with what we would call hard to reach groups, people that don't traditionally give us their thoughts and ideas. We've done lots of work in communicating in different ways, such as going onto the radio and doing specific phone-in shows, and we've done work on the website where people can actually be part of discussions online, and we always use a variety of different newspapers to communicate messages to people. So I hope that's been a helpful overview of how we try to ensure that we are a patient-focused organisation, and that by working on involvement and engagement at the 4 levels, the running of the Gateshead CCG, the way we work with services, the way that we listen to feedback through practices, and by different work directly in the community, by working at all of those 4 levels, that we have a real chance of improving the services and getting the best health for Gateshead. Of course, services could always be better, and of course the way that we listen to patients and how we improve those services could also be better, and we'd love to hear your ideas. I want to end though by listening directly to one of our patient representatives and how they think we're working with patients.
Obviously, I know there's a drive from the government to really involve patients, but I think there's a real desire for the clinicians and indeed all our partners to make sure that we get the best possible service we can for the people in Gateshead, because perhaps at one time all of us will become patients at one stage or another. Yeah, the Patient Public Involvement Group is an association of patients, obviously, and officers from voluntary organisations, or indeed anyone that has a vested interest in health and social care within Gateshead. So it's quite a new format, you know, to get access to the board with issues, and I think it's a tremendous step forward. But I think we're all striving for the same thing, the best possible service for Gateshead that we can.